Hi, everyone. I'm Steve Kep, co-founder of our company From Day One, a forum on corporate values. Welcome to today's webinar, in which we'll be exploring a pressing topic, supporting mothers and babies in a global pandemic. From disruptions in food systems to overwhelmed health networks, COVID-19 has created a global health crisis that calls for a response from both government and business. Nearly 1/3 of women residing in low and middle income countries around the world do not have access to basic health services and are at increased risk for poor nutrition. The world's most vulnerable, including pregnant mothers and infants throughout the US, are now even more vulnerable. In this intimate conversation, we'll discuss how corporate leaders such as Walgreens are leading the way in addressing the fight to improve child and maternal health. Before we dive into this topic, we'd like to thank our partners Vitamin Angels, Walgreens, and Cause Partners. I'll tell you a little about each one. Vitamin Angels is a charity providing life-saving vitamins to 70 million women and children annually around the globe who are at risk of malnutrition. The organization aims to reduce health and economic disparities across the lifespan by effectively delivering evidence-based nutrition interventions. Walgreens, one of the nation's largest pharmacy chains, is proud to be a neighborhood health, beauty, and retail destination supporting communities across the US. The company was named to Fortune magazine's 2019 list of companies that change the world. Approximately 8 million customers interact with Walgreens in stores and online each day. With over 9,000 locations, Walgreens is committed to improving the health and well-being of each community they serve. Cause Partners is a consultancy that helps bring nonprofits and companies together to form mutually beneficial partnerships. Cause Partners has helped nonprofits such as Meals on Wheels America, the National Wildlife Federation, the U.S. Soccer Foundation, and Vitamin Angels secure vital financial, promotional, and in-kind support from companies the likes of Kroger, Subaru, Adidas, and Dick's Sporting Goods. Now, a few quick logistical items. This webinar is being recorded and will be available on demand within 24 hours after the event. Look out for an email in about 24 hours with the link. That email will also have info on education credit from the professional organization SHRM for this session. And look out for a written account of the conversation next week on our website, fromdayone.co. At around 2:45 p.m., we'll have a Q&A session. You can submit your questions anytime using the Q&A button at the bottom of your screen. Now I'd like to introduce our moderator, the business journalist Lydia Dishman, who reports and edits for Fast Company on tech and leadership and has written for CBS Money Watch, Fortune, and the New York Times, among others. Okay, Lydia, over to you.
Thank you so much, Steve. Thank you all for joining us today. We have, as Steve said, a very timely discussion that I'm delighted to be facilitating, in part because this issue is important to me as a mom. Although my kids are older now, I will never forget the early days of my pregnancy with each of them, nor will I ever forget the anxiety that comes along with being a new parent. It was assuaged in part because I always had access to good health care, and I'm privileged enough to provide good nutrition for my family. But not everyone is that lucky. Millions of mothers and babies around the globe are battling malnutrition and lacking basic health care. And this is where the organizations that we're going to speak to today come in. So without further ado, I'd like to kick this off by having our panelists introduce themselves, tell everyone a little bit about their role and their connection to this topic. So why don't we start with you, Dana?
Hi, everyone. Thanks for having me today. I'm Dana Glem. I'm a director of brand marketing at Walgreens, and my team and I have the pleasure of leading Walgreens community efforts, which include our charitable partnerships. I'm really glad to be joining you today to speak specifically about one of our longest standing partnerships with Vitamin Angels.
Dan, why don't you go next?
Thank you, Lydia. I'm Dan Cohen. I'm the founder and president of Cause Partners. We're a consultancy that essentially helps nonprofits and companies form partnerships that both drive meaningful social impact and drive some very specific business objectives that a company would be trying to achieve in the process of doing good in the world. So thank you very much for having me today, and I look forward to the conversation.
And last but not least, Scott.
Hi, Scott Minger with Vitamin Angels. I'm the Senior Vice President of Business Development and working to build impactful relationships with corporate partners such as Walgreens. Excited to be here.
So before we launch into the full conversation, we're going to feature a brief illustrated introduction to Vitamin Angels, and that's going to be narrated by Brittany McMeekin of Vitamin Angels. Brittany, take it away.
Yeah, thank you, Lydia. And thank you, everybody, for joining us today. I'm really happy to be here with all of you and really kicking us off and sharing a little bit of background information in regards to the global impacts of malnutrition and undernutrition. So we have a lot of information on these slides that follow, and we've included this just in the hopes that you would find it useful and for you to reference it. As far as what I'm speaking to, I'll keep it pretty high level. And if you have questions throughout this presentation, feel free to chat those, and then Lydia will be able to read them and we'll either answer them or discuss them afterwards. So first, to clarify, malnutrition is really just an umbrella term for poor nutrition. And that can refer to an excess consumption of nutrients, which can lead to medical conditions like obesity and high blood pressure, or it can refer to an underconsumption of nutrients or an underabsorption of nutrients, which is then referred to as undernutrition. And as this quote says here from Dr. Bronca, malnutrition is really the main cause of death and disease in the world. Next slide. Some of the consequences of undernutrition are things like a compromised immune system, repeated illnesses and infections, being underweight for one's age or stunted, which is too small for one's age. Malnutrition, while we might become a bit numb to hearing about it, is actually a world health crisis, and it's one of the largest that we face. So why is malnutrition considered a world health crisis? Well, ultimately, this intergenerational cycle affects the ability for entire nations to rise out of poverty and to increase their GDP. So the cycle begins when a woman becomes pregnant. The nutrition that she's receiving during this critical time affects the growth of her baby. And oftentimes we know from the work that we do and the traveling we do that mothers are the last to eat in their family. They'll prioritize the meals of their husbands and their older children over themselves. So this lack of food, lack of variety of food, of quantity of nutrition can really make a pregnancy a very precarious situation. After an infant is born, then exclusive breastfeeding is extremely important. And for this to occur, the mother really needs to have had an adequate nutritional intake throughout her pregnancy so her body can produce milk and then be educated on the necessity of not introducing any other foods or water during that time, which can lead to an increase for risks of waterborne illnesses or infections or diseases. You don't want to introduce nutrient-poor foods when a child is really young. So then we move into a child's preschool years and the first 1,000 days of life. And really, this is a critical time. It has a huge impact on their growth, development, and their success as an adult. The nutrition that a child receives through their first 1,000 days of life is absolutely critical. You know, this not only affects physical markers such as their weight and their height, but it also affects their cognitive development and their cognitive functioning. So if a child is stunted physically, then they're also stunted mentally. And the damage done during this time period is irreversible. There's no way to make that up after age 5. When a child does develop then properly physically and cognitively, this increases their ability to receive an education, which increases their ability to get a decent job. It allows them to support themselves, their family, to rise out of poverty and contribute overall to a nation's economic performance. So we're all very aware that nutritional needs increase during pregnancy. Micronutrients, vitamins, minerals, all of these things are essential to the proper development of the baby's bodily functions, including that baby's immunity. In the US, for example, we would never dream of going through a pregnancy without taking a prenatal vitamin. And then before COVID-19, we were already facing some pretty extreme statistics and challenges in the area of maternal and child health. So around 165 million children under 5 were stunted, had stunted growth, compromised cognitive development, and physical capabilities. And then there are around 110 women who are dying every day due to preventable causes that were related to pregnancy and childbirth. And now, since the COVID-19 crisis, we've seen declines in access to child health and nutrition services. Then you have major disruptions in food supply chains, you know, loss of jobs, which is estimated to throw an additional 140 million people into extreme poverty. And then food insecurity is expected to nearly double by the end of this year. And all of this has severe implications on child malnutrition rates, as a family's access to healthy, nutritious food sources declines even more. So those who are already vulnerable are now even more vulnerable. and those who are barely getting by before are moving into this high risk category. So it's expected that we'll continue to see an increase in child malnutrition rates, including wasting due to things like steep declines in household incomes, changes in the availability and affordability of nutritious foods, and delays and disruptions to important services such as health, nutrition, and social protection services. And the population, of course, who is most severely affected here and the most at risk are pregnant women and children whose health is already extremely vulnerable. And it's already so important during these first 5 years of life. So the overall outcomes and the impact this has on our communities, entire countries, and our world as a whole due to the losses in economic advancement and productivity and schooling, and even more, it means that we really can't afford for nothing to change. And on that note, I'm going to turn it over to Scott Minger, our VP of Business Development, to tell you a little bit more about Vitamin Angels, the organization that we work for.
Thanks, Brittany. So Vitamin Angels, our mission is pretty simple. So we are really helping at-risk populations in need, specifically pregnant women and new mothers and children under the age of 5 gain access to life-changing, life-saving vitamins and minerals. And what we do is generate resources to promote health and economic equality across the lifespan by ensuring nutritional, vulnerable, underserved populations have access. And this is access to evidence-based nutrition interventions. Vitamin Angels is a global public health organization that's backed by science with the interventions that we have. We like to think that we're experienced and impactful. So last year we reached over 70 million women and children with life-saving vitamins and minerals. Our model is really working with local NGOs, local community groups. We've got 2,500 plus program partners around the globe that are in these communities that know these families, and we provide the product and the technical assistance that really allows us to scale up quickly in a sustainable fashion as well. We're in over 70 countries, and we take a lot of pride in that we're in the top 4% of charities ranked by Charity Navigator. So we're incredibly fiscally responsible with the cash that we receive from our corporate partners. So Vitamin Angels works towards achieving nutritional quality. Everyone really, our goal is to get everyone to have fair access to services needed to achieve, again, that optimal nutritional health, regardless of sex, age, race, or ethnic background. This is our mission. This is our vision, that we work really hard to removing those barriers to those unjust systems and processes to ensure individuals have healthy diets, healthy environments as well, and access to healthcare. So Vitamin Angels' approach really is multifaceted. Certainly it's driving awareness to the benefit of vitamin supplementation in these communities that need it the most, along with providing availability. So working with these community groups, our program partners around the globe, and giving them the product that's needed and putting it in the hands of these women and children. Making sure that, that the compliance is there and that they're taking, as an example, that the mothers are taking the prenatal vitamins, right? And so making it easy to digest in a form that will allow them to take it consistently. Accessibility along with affordability are really the areas that we're really focused on with these families. Here's a map, just a quick overview of where we work. Really proud to say we're in all 50 states in the United States, and working in Canada, Mexico, parts of Africa, Latin America, and then Southeast Asia as well. So continuing to grow, again, over 70 countries that we're working in today. So what does all this mean? it's at the end of the day, it's one of the lowest cost, highest impact interventions that are out there. Back in 2011, the Copenhagen consensus declared micronutrient supplementation was really the #1 cost-effective solution combating global malnutrition. This is our vitamin A program that we're speaking to here. You can see these bottles of vitamin A and our prenatal on top as well. But the cost of high dose vitamin A is only 25 cents, and that's per year. And what's incredible is when given that intervention, it's been able to show reduced under 5 childhood mortality rates by 24%. Right. So there's not much in this world today that you can get for a quarter anymore. Something that's highly impactful and incredibly cost efficient with proven science behind it. Thank you.
Thank you, Scott and Brittany. So, of course, this was information filled, but I have questions. And my first one is, Brittany, you had touched on the impact that the pandemic has had on underserved communities. And I want to dig in a little bit more on that. What in particular is Vitamin Angels doing differently? Are you doing anything more or less to help those underserved communities during this time?
Yeah, so, it's certainly been a roller coaster over this last year, last 8 months. And as you heard in the presentation, of course, access to healthcare has really been compromised. And those populations who we serve were already the most marginalized and the most vulnerable and hard to reach. So things like delays and closures of health facilities and routine checkups and vaccination schedules, all of that was really detrimental. And Vitamin Angels, we work with about 2,400 different in-country program partners around the world. And those are hospitals, clinics, NGOs that are locally staffed and established in the countries that they're working in. So we were in pretty regular communication with these organizations throughout this time. And we were providing support to them as they work to adapt to the changing circumstances. And for example, in Kenya, our program partners in Kenya were starting to go door to door because their clinic was closed. So they were then distributing their prenatal vitamins door to door. And we saw that happening in a lot of other countries as well. And also right here in the US, a lot of our US program partners started setting up clinic check-ins in the parking lot. And they would have women drive by to pick up their prenatal vitamins or pull into the parking lot so they could have a conversation with them as they sat in the car. And we were, prepared in every way that we could be to ensure that our supply of vitamins and of prenatals was always readily available as they pivoted to really meet the needs of this changing environment.
Yeah, I could imagine if regular retailers were having trouble keeping stock of things like toilet paper because supply chains were disrupted. It's, quite a big challenge to make sure that you have the nutritional supplements available when you need them in a contact-free delivery almost.
Yeah.
Certainly a challenge. Dan, what about Cause Partners? What have you noticed?
Thanks for the question. I think noticed certainly a bunch of different trends with the way companies are handling the situation. First, I would say is probably an acceleration of an existing trend, and that would be that corporate social responsibility is not just something that companies do. It's now a part of who they are. It's built into the DNA of the company. And we've seen that happening for a while, but I think that has been dramatically accelerated by COVID and the impact that COVID is having. Related to that, I would say that it's different across industries. There are obviously certain types of companies that are thriving during the pandemic. You think of the Amazons of the world, the Instacarts of the world, meal kit delivery companies. Those companies have the resources and frankly responsibility to do more. So they are not only supporting existing partners, but you'll find them engaging in new partnerships that are topical, whether it's COVID-19 or racial and social justice or the environment, the topics of the day. There are other companies that are maybe doing a little bit better, but fairly static. Think of supermarkets, the Krogers, the Aldis of the world. And what I tend to see is them making sure to support the partners that they have been working with for a long period of time. Sometimes we forget that there are nonprofits that are working right in the core of the issue. But if we ignore those other nonprofits that we typically support, they are not going to be able to do the important things that they're doing. Then lastly, there are companies that are not doing very well. As a result, you think of retailers, restaurants, and they're finding it difficult to support those partners that they have been with for a long time. And the third and final trend I would mention is that I think we're starting to see a little bit greater connection between companies making that direct connection between supporting a nonprofit and sales or income, and not being afraid to be shy about the fact that if and when a consumer purchases a product or a service from that company, there will be a direct relationship to a donation that will go to a charity. There are many surveys that talk about people wanting to purchase products and services from companies that are doing good in the world. And I think we're seeing companies really trying to leverage that more and more to translate to the bottom line.
Which is a natural lead-in for me to ask Dana about Walgreens' involvement and how the role has developed over time.
Yeah, thanks. I think something that Dan just said really resonated with me, and it resonates with Walgreens as a brand. We ingrained in our purpose, and something that's been really important to us for years, since our organization has always been around, is to really help people live healthier, happier lives. And so supporting organizations like Vitamin Angels or other organizations that really make an impact on the communities that we serve has really been ingrained in our history as a brand. We have a genuine commitment to, helping improve the health and well-being of these communities, and it's something that we take very personally, and it's something that we're really committed and dedicated to, and we've been doing for quite some time. And the impact of COVID has only reinforced our commitment to this, and our desire to continue to do even more. The way that we are able to make this impact and to give back to communities and to really look after the health and well-being of them is through partnerships, just like Vitamin Angels. And we're sort of seeing it come to life through CSR now more than ever. But the Vitamin Angels partnership with Walgreens is one that dates back to many, many years now. We actually first launched this program in 2013. It was a 30-day program that we stood up in our stores on a single end stand. And really the idea was, when you purchased a vitamin from that display, a donation would be made to this cause in support of their efforts to end malnutrition. And we really saw that our ability to connect, cause to a customer purchase could be really impactful. It was sort of this idea of purpose beyond purchase. And it was a really simple way for customers to engage and to give back. And so because of that, we actually transformed the partnership into not just a 30-day program, but something that is always on in our stores. So, every day you can walk into a Walgreens and you can purchase a vitamin or a supplement, and we will make a donation to the Vitamin Angels Foundation. And this is through the support of national brands, national vitamin partners, as well as Walgreens owned brands. And I think, it continues to deliver on, one of the ways that we are able to give back to communities, and particularly now, how we can continue to do that and how we look to do more of that. How are we able to amplify purchase to then give to Vitamin Angels so that they can do more, given the situation that's at hand?
Well, thank you for that answer. And it's great to hear that the commitment is only grown stronger over time, but don't want to let you go quite yet. I just want to know if you've seen any difference in consumer behavior during this time. If you're connecting the consumer to the cause, have you seen actually more engagement with buying those brands for donation?
Yeah, well, I think one thing that we saw, just even independent of probably the cause itself, is during COVID, there was a definite desire for individuals to purchase more vitamins. A lot of people were just trying to stay healthy. And so we did see sort of an uptick in the amount of sales. But I would say, the research does tell us, and we've seen this across other partnerships as well, customers are more engaged and more motivated and have a higher propensity to choose a retailer if they feel like they are doing good by shopping there. And particularly in the wake of COVID, one of the things that we've seen especially be true is that people want to make an impact in their community. They want to be able to give back and to support local, or to support things that are going to have an impact on the community that they live in. And so that's been really important with our partnership with Vitamin Angels, is to reinforce the individuals that are receiving this support and this benefit from them as an organization are, of course, across the world, but also here in our own backyards, here in the United States, mothers and children that need support. And simply by purchasing these vitamins, you're empowering them to do that. And so I think by making it really easy, it's definitely been something that we consistently see to be a motivator, and something that our customers really truly enjoy and give us credit for, and really appreciate that our brand participates in.
Thank you. I want to dig a little bit more into the nuts and bolts of these corporate partnerships, and why they are important and effective, for Vitamin Angels and for the brand. Dan, can you enlighten us on that one?
Sure. And I think Scott may want to chime in if he gets a chance. So I'll be brief, Scott. The way in which Vitamin Angels works with corporate partners really depends. And I know that's a very vague answer, but I think Vitamin Angels does a great job of first talking with corporate partners to determine their goals and objectives and what they're trying to accomplish with a partnership. And everything revolves around that. So step one is to really understand what a company is trying to accomplish as a business through a nonprofit partnership. And then once there's the determination that there's an alignment with the company, then we start to talk about what's the story that we want to tell, what's the press release headline, and how do we then implement certain tactics to make that come to life and have real meaningful social impact. I think the beauty of the Vitamin Angels model is that you can have a tremendous amount of impact, as Scott mentioned, at a very low cost. It's an extremely cost-efficient organization that can scale its impact dramatically with the introduction of new funding. But getting back to real quickly the customization of it, just cite a quick example of a new partner with whom we're working, a company called Jonas Paul Eyewear. They sell children's glasses. When you think about the name Vitamin Angels and Jonas Paul Eyewear, it may not immediately be apparent what's the connection there, but vitamin A deficiency happens to be the leading cause of preventable childhood blindness around the world. And this company, through conversation, we set a mutual goal for impacting 1 million children around the world to help prevent them from going blind. And it took a long time to get there. It's a very simple statement, but it's one that's really easy to understand for both the internally and externally, and one that we'll take to market and gather stories to inform consumers about what we're doing and why we're doing it. So it really just depends on what a company's goals and objectives are. And I think the fact that Vitamin Angels is on the cusp of a broad category of health and well-being for women and children makes them applicable to the goals and objectives of many companies, not just companies that sell vitamins or companies that may seem to be really immediately apparent partners, but it's a really broad spectrum of organizations that are interested in the health and well-being of women and children.
Well, Scott, from where you sit in business development, you're dealing with all different kinds of companies, all different kinds of corporate partnerships. So can you also talk a little bit about how those work?
Yeah, every one of our partnerships are unique in their own way, right? And at the end of the day, we like to talk about we're the vehicle by which we bring one of our partners' mission and purpose to life, right? We're very business centric, right? And so, corporate partners today, businesses today, all have a vision and a mission statement, a purpose, right? But consumers more than ever demanding to see how they're executing against those visions and missions and purposes. And so we're the vehicle by which our corporate partners can demonstrate the good that they're doing, right? And so every situation, every corporate partner, every budget is different, but that's really what we do and have been successful in is crafting a campaign that is unique and works for the objectives that our partners are looking to hit. We would love to think that all of our corporate partners could be as amazing as Walgreens and donate every single day for every product sold. Unfortunately, not everybody has those same capabilities, right? And so it's really kind of crafting a program, a campaign, a partnership that meets their objectives in the long term.
Well, but as you said, though, it's hard to beat the value proposition of a quarter. It's 25 cents to change lives is really an incredible value proposition. But for a company like Walgreens, Dana, I'm just thinking about, beyond the humanitarian impact. I know that a lot of CSR revolves around engaging employees too. So can you talk a little bit about what the additional benefits have been from this partnership?
Yeah, absolutely. I mean, I think they're tremendous. And actually, just to quickly build on what Scott mentioned and Dan both mentioned there, what I think is so wonderful about the partnership with Vitamin Angels as it relates to Walgreens is we know that we want to help improve the health and well-being of our communities, but we don't have the expertise in terms of what does everybody specifically need and where is the need greatest. And so I think that's one of the benefits of the relationship with Vitamin Angels is it's extremely collaborative, to Scott's point, in the sense that if we are looking to achieve goals, they're there to help us do that. But at the same time, they're also there to help us identify where the need is greatest and where we can make the most impact, and therefore, align our goals and our objectives around those communities. So I think that's just another thing that I certainly wanted to build on, because, as a pharmacy retailer, we have expertise in many places. We know we want to be giving back. We know we want to be focused on health, but we find partners like Vitamin Angels that can help us have the greatest impact where the need is greatest. And then to your point, or to your question, Lydia, there are so many, benefits of this partnership. I think, we just, one of the biggest ones obviously is the impact that we're able to have together. One of the milestones we just have achieved together as two brands is, we've reached 250 million lives through this partnership. That's 250 million individuals whose lives have been improved through, access to these supplements and these vitamins. So for us, that's one of the greatest achievements. From an employee perspective, that's actually one of our biggest benefits as well, because our employees are our number one asset, and they truly love programs and partnerships like this. They become so engaged when we activate any of our cause partnerships, because they love to be able to participate in something where they feel motivated, and they feel like they're truly making a difference. And what we've found is that when employees are engaged, we actually see way more benefit in store and with our customers, because our employees and our team members, as we like to refer to them, are the ones who are bringing this to life for the customers. So if they're engaged, the customer is going to be engaged as well. And so it's of tremendous value for us in terms of engagement with team members and having their support. It's one of the things, the campaigns, I would say. I've seen quite a few campaigns at Walgreens, but cause is one of the campaigns that they get most excited about.
And I'm sure there are NPS scores to prove it as well. I know that a lot of companies measure those NPS scores in terms of employee engagement and how that translates to customer service. And when an employee is engaged, they're always going to be able to give the customers better service. So everybody wins. So again, digging into the nuts and bolts a little bit more, what advice, tip, lesson would you offer to brands seeking to invest and move the needle on particularly this issue of child malnutrition? And this is for all of you, so I'll take a volunteer who wants to go first.
I'll take a stab at that, if that's okay. Can I answer something other than call me to talk about Vitamin Angels? That would be number one, but then after that, close second. I think Dana really summarized it brilliantly in that step number one is to identify the areas of greatest need and the potential for highest impact. What's interesting is sometimes they're not the same. The areas of highest need may be being met by other companies or other foundations or other supporters of those causes. So to find the intersection of the greatest need in the area in which you can have the potentially greatest impact, I think is great. Second is to find credible partners that can help actually fill that need and have that impact, and as measured by a variety of different statistics that can prove out impact. And lastly, once you do that, let the partner do their work. The nonprofit, as Dana really nicely pointed out, these organizations exist because they fill a need and they know what they're doing and they're effective. You really want to, as a corporate leader, avoid the temptation to drag nonprofit organizations out of scope and to try to do things that they are not necessarily set up to do. Let them focus on the highest and best use of their talents and resources. And lastly, cash is king, and all nonprofits want cash, but also think about what other, I like to use the term talents and treasures. What other talents and treasures exist within your organization that can help an organization have impact in addition to the much needed cash investment?
Yeah, I can certainly build on that as well from the corporate partner perspective. I would say, really ensure that a partner aligns with sort of your mission as a brand, because there are tons of partners out there that do a lot of really tremendous work in the world. But if it doesn't ladder back to what you as an organization are, focused on, and where your strategies lie, and what your customer believes to be true of you as a brand, it's going to feel disconnected. And that's where I think, to Dan's point, you start pushing the partner to move into spaces where they're maybe not innately scoped to serve. Like, just as an example, I was thinking about this ahead of time. If Walgreens sort of align themselves to an animal shelter organization, it might not innately track back to who we are as a brand and the value that our customer sees from us. But as a healthcare company, it makes a lot of sense that we are trying to improve health and improve well-being of communities. And therefore, a partnership with Vitamin Angels, who has similar goals and ambitions, is really strategic, and it makes sense and it's thoughtful. So I would just say, make sure that the partnership ties back to the value that you're able to offer, because then that really, you have to do less work to convince your customers that that there's value there and that it makes sense. It just feels really organic and authentic, which is most important.
And so, Brittany and Scott, from your perspectives, how would companies go about this, especially if they want to move the needle on childhood malnutrition, undernutrition, using the umbrella?
Go ahead, Brittany. I will let you go first.
Well, I think that a lot of good points have already been made. And I think, what Vitamin Angels specializes in is understanding what the company's goals and objectives and purpose and mission is, and aligning really nicely to that. And then making sure that the partnership is multifaceted. and that we're interwoven throughout all different areas of their business. As Dana's pointed out, the way that we're engaging with employees is equally as important to the way that we're conveying this powerful message to customers. And that may not be the same message. You know, we'll work with you to really customize the statement and articulate what needs to be said that's powerful and impactful to the customer. And then what tactics and strategies we can employ that are really going to empower and strengthen your employees, you know, your employee base and your company culture. And we just have such, we have so much experience doing this. You know, we've been around for 26 years now. And this is how we've always aligned ourselves. We're a unique nonprofit in that regard. I think a lot of others depend on individual donations, and we work almost primarily and entirely with corporate partners. So this is what we're best at and what we do.
Yeah, and I think I would just add on to what the panelists have been saying and building off of what Dan and Dana have said. And I think it's really important that you build authentic and sustainable partnerships, right? So one of the biggest challenges as a nonprofit that we face is a donor that's donating this year but disappears the next year, right? And so we're really focused on building long-term, sustainable, growing partnerships, right? And making sure we're authentic to that. And so, you know, it's less about, you know, how big is that, you know, check going to be out of the gate. It's more about, you know, how do we build a partnership that we can grow together with, that's around, you know, for decades. And that's really what our focus is with each one of our partnerships.
Well, of course, we could talk about this for hours, but I do want to make sure that we have enough time to get to our audience Q&A. But before we do that, I'd like to invite Steve to come on briefly, remind us where we are, what we're doing.
Thank you, Lydia. Thanks to everyone who's joined our From Day One webinar on supporting mothers and babies in a global pandemic. Our sponsors are Vitamin Angels, Walgreens, and Cause Partners. At this time, we'll be taking some questions from our audience. You can send them to our moderator, Lydia, with the Q&A button at the bottom of the Zoom screen. Lydia?
Thank you. Well, we already have a bunch rolling in here. So this one is asking about unique challenges on the ground where you distribute the vitamins, logistical, political, cultural. So I guess either Brittany or Scott can pick this one up.
Brittany, you have more experience and actually been in the field, so why don't you go ahead?
Well, you know, it's a difficult question to answer because we're working in so many countries and in so many different communities that the challenges really vary from place to place. You know, it's as an organization, our focus has always been supporting those communities that are most at risk and most in need, the most marginalized. So those who wouldn't otherwise have access to nutrition services through the government, we focus on like that 30% that is really challenging to reach. And this can be due to so many different factors. It's geographical factors. For example, I visited Peru quite a few times. We're working high in the Andes in Peru, at elevations of 14,000 feet where nothing grows but potatoes. So this is the indigenous communities and populations that we're reaching up there. And, you know, our program partners are driving 2.5 hours over these bumpy roads in a van every day to reach these clinics and these centers. And oftentimes we'll see geographical as being a big barrier to addressing the health needs of communities. And then other times it will be political. It will be, we'll be working in a big city, but due to the politics or the cultural background or the ethnicity, the religious beliefs of a group, they're not able to access the government services from that country. So then we're finding those little pockets where we're actually in these huge cities where you'd think it'd be easy to receive nutritional support. but we're having to really serve and focus on a group of individuals, of communities and people there. So it's a great question. We also have great stories and videos. So if that person is interested in getting in touch with us directly, I can certainly, provide more of those specifics.
That's great. Thank you. Yeah, I would just encourage, I guess, to just visit your website because you do have a lot of information there. Scott, did you want to add anything to that?
No, I think Brittany did a marvelous job. It's something that absolutely is a challenge that we're facing day to day, and our program partners are. And so, yeah, absolutely.
All right, so we can go on to the Walgreens point of purchase connection seems natural, but how might a different kind of retailer or other business partner find a logical connection? So I guess any of you can answer this, but here comes Dan coming in hot.
You saw me chomping at the bit to answer that question, huh? I think Dana has done a nice job of pointing out that we want to be mindful of what inspires and motivates employees and what inspires and motivates consumers. If you think about the umbrella benefit that Vitamin Angels is providing, going back to something I think I may have mentioned earlier, it's about the health and well-being of women and children. Most employees and consumers can get behind that. So it doesn't necessarily matter as much what the product is, it's what the purchase will accomplish. So whether you're buying something at a grocery store, a pharmacy, a clothing store, if a product purchase can help a mother or a child at risk of death from undernutrition, then that can be a successful program. It's all about how to tailor the message to the specific audience of the business, but the scope and the types of businesses that can benefit from that high level impact of that population are almost infinite.
Dana, did you want to add anything to that?
No, I think what Dan articulated is right. I mean, for us, obviously, there is sort of this organic fit as we are a vitamin retailer. But as long as you're finding ways, we participate in a lot of other partnerships that don't tie to a specific supplier product, right? You don't always have to activate via a point of sale purchase. Just ensuring that, I think, to my earlier comment, that the relationship ladders back to more broadly what you stand for as an organization. I think that's fundamentally the most important thing. And then there are tons of ways to figure out how to then bring that to your customers based on how they engage with you every day as a brand.
Well, on a somewhat related note, we have what aspect of the program touches consumers the most? The emotional appeal to helping people, the rational appeal about the impact a small donation can have, or some combination?
I think it's definitely a combination of the two. And I think what we have found through working with a variety of partners, including Vitamin Angels, is ensuring that the donation feels authentic, that it feels tangible, that it's something the customer can really understand and see the benefit of. Those are some of the most important pieces to then having a customer engage and want to participate on an ongoing basis. And that's really what we try to do through our, I lead the brand marketing. So that's what we try to do through our marketing efforts is turn this purchase and this percent of a donation that's made into a tangible impact that the customer can see. Who is that child that's benefiting from this purchase? Who is that prenatal mother that is going to receive supplements because of what you've done? And I think that's really the most important thing. So I think it's a bit of both, right? There's certainly an emotional appeal there, but there's also a very tangible aspect. And, I mentioned the scale of 250 million before, but that feels big. That's a big number, and it's hard sometimes for people to really put that into perspective as to well, what does that really look like? So we try to really dive in on the tangible story, the one-to-one connection, because I think that that really is what moves people to then act in the future.
Yeah, and just to build on what Dana said, at the end of the day, needless to say, we're all living crazy lives right now, right? It's a different world than we could have ever imagined, and I think it's about providing opportunity, right? And so that's providing opportunities to the beneficiaries, the women and children we serve, but it's also providing, our corporate partners, their consumers, the opportunity to give back, right? The opportunity to make an impact with their purchase, right? And so that's very much at our core, whether it's providing folks like Dana and Walgreens and their team members the opportunity to really make a difference in their work lives, or the consumers by buying vitamins at Walgreens, the opportunity to make a difference with their purchase that really is seamless, right? And that's the beauty of the program. You're going to buy vitamins somewhere. Why wouldn't you buy them at Walgreens? And for their team members, they're going to sell vitamins. It's a very simple call to action. And again, it's providing that opportunity that I think is what led us to really having a ton of success.
Well, here's another nuts and bolts question from Teresa. Wants to know, for cause marketing partnerships, did it start as a grant cash partnership and move into cause marketing relationship?
So the way Vitamin Angels was really developed from our founder, Howard Schiffer, 26 years ago, was really more around product donation. So we had, there was an earthquake in Southern California, and Howard came from the vitamin industry, and was asked by public health officials if he may be able to help secure vitamins for children that were now essentially homeless with their families. And so Howard, very, the way he tells the story is very simple. He made a couple phone calls and got a few pallets of vitamins delivered. And as he progressed through that and learned more, he really found out about vitamin A, the vitamin A deficiency globally. And really, he tells a story that somebody told him it cost $0.25. And he's like, wow, 25 cents a day? They're like, no, 25 cents a year, right? And so that's really the birth of Vitamin Angel. So it did start from more of a product donation. Over the years, we've migrated to more cash donations to give us that freedom to manufacture the product with our contract manufacturers, and allocate the revenue based on the overall need and where it needs to be. But it has been an evolution over the last 26 years.
Well, Wendy has a question for Dana, but I think Dan can chime in on this one too. Is there any friendly competition or challenge between Walgreens location for engagement in this campaign? But I think this could really go for any campaign. So Dana, why don't you start, and Dan can give us a hot take after you're done.
Yeah, absolutely. That's one of the biggest sort of tactics that we deploy when it comes to our cause partnerships, whether it's Vitamin Angels or any other. We do find that the stores love to sort of engage in a little friendly competition and like to see sort of who can raise the most money or who can sell the most of a certain product in order to reach a goal or win a prize at the end. And we've done things in the past with Vitamin Angels where this idea of a simple quarter could really make such a difference on the life of a child. And so, equipping the stores to challenge each other to see who can raise the most money, who can get just a quarter donation from a customer, and where we sort of land in terms of competing against teams, whether it's in district or, we have sort of an Eastern and a Western division, and they love to challenge each other to see who can sort of raise the most money. So that has definitely been a fundamental component of the campaigns that we run around these charity partnerships. And a real, one of the biggest ways that we raise cash and we find engagement.
Go for it, Dan.
Obviously, I think Dana knows best on this topic because it's real world evidence. I think I'll just add to that. There are some really interesting studies that the results suggest that people are more likely to take an action that will benefit others than an action that will benefit themselves. There's some research about, for example, people being able to earn bonuses within companies, a cash bonus for themselves for some sort of performance versus a donation that will be made to a charity in their behalf for the same performance. And people are generally more inclined and inspired to do something on behalf of others. And that gets back to those contests and that Dana obviously runs very effectively within Walgreens. People want to help other people, and it can be used as a great way to build employee engagement, to build morale, and to do some good in the world at the same time. So it's a win all the way around.
Well, speaking about helping yourself versus helping others, this question's about, to some degree, developed countries in the world, including the US, have turned inward. Do you feel like you're swimming against the current? Does that make the mission even more important? Scott or Brittany?
Go ahead, Brittany.
Yeah, it's a really good question. And it's reflective of a challenge that we have come up against a little bit more consistently in the last 5 years, I would say, which is perfectly understandable, but it's this desire for people to be giving back to those who are in their own communities and then those who are in their own country. So our programs have grown really significantly, as kind of Scott was saying, across the US, because there is a real need here to support the health and the well-being of expecting mothers. Though, because we're also an international organization and we're reaching 70 million children all over the world with vitamin A and deworming medication, we're consistently having to help people see the importance of not only supporting their local health, but supporting their the global health and supporting global communities. And I think that in a sense, this pandemic has really, it's shifted us in both ways. It's shifted us locally, but it's also given people a real understanding of what the threat of illness feels like and what the loss of job and security and health services feels like, and I think that's helped people to understand what those in need in developing countries all over the world have been facing for a long time, and what they then continue to face and what we help them to continue to overcome.
Well, in the last couple of minutes that we have here, we're going to look to the future and ask you, does Vitamin Angels have plans to expand or evolve? Scott, do you want to help us with that one?
Yeah, absolutely. It really is an exciting time right now for Vitamin Angels. We're expanding our prenatal program here domestically, and really focusing on marginalized communities throughout the country that don't have access, that have barriers not too dissimilar to some of the challenges that we face globally. So that's certainly a very large priority, especially as it relates to our partnership with Walgreens and making those local impacts. And then, we continue to expand and take a leadership role internationally when it comes to micronutrient supplementation, both with vitamin A and prenatal. And so that expansion will continue. And from a fundraising and development perspective, we're making some really nice progress. Walgreens just announced they're taking us globally as part of Walgreens Boots Alliance. And so that means we'll be in 5 or 6 new countries from a fundraising perspective. So we're incredibly grateful for their ongoing commitment.
Amazing. Well, that's about our time. So Dana, Dan, Brittany, Scott, thank you so much for taking the time with me today. It's been my pleasure to chat with you. Steve?
Hi, thanks, Lydia, and all our wonderful speakers. That was a really inspiring conversation. Thank you again to Vitamin Angels, Walgreens, and Cause Partners, and to all of you for participating today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars. Here's a few. This Thursday, October 29th, the topic is Building an Anti-Racist Culture in the Business Community. Next Thursday, November 5th, the future of remote work, gauging the long-term impact on engagement and performance. Tuesday, November 12th, improving communication and engagement in a remote workforce. And November 17th, our monthly virtual conference, Supporting Families, How Employers Can Help Workers in Challenging Times. Thanks everyone very much. Be well.